Good morning, and welcome to this week's episode of Ask Dr. Murphy. We will be back later this week again. I hope everyone is doing well today. My name is Katie Berg, and I'm a research study coordinator with the Havey Institute. I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy this morning. How are you, Dr. Murphy?
Well, I'm doing fine today. Last week we didn't have the this particular show because I was traveling actually in South Africa, and it was just a little bit too complicated to do this. But we'll try to catch up. There's a lot of news to present.
Absolutely. And Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines, our lone US COVID statistic through today, March 24th. We invite you to submit any questions or concerns down below in the comments or via any of our social media linked in the description. Starting with that COVID statistic, in the last reported week, average COVID deaths per day were down to 64. The same week in 2024, we saw 181 daily COVID deaths. Dr. Murphy, your reactions to those numbers and the status of COVID in the US?
Well, the status of COVID, as predicted, these respiratory viruses start going down in March and April. So we're almost into April. We're at the end of March, and the number of cases, as we're going to talk about in a few minutes, are going down. So 64 deaths per day. We had over 100 just a few weeks ago. So even the death number is going down. But the key thing is it's a lot less than it was last year. It was 181 per day now. So that's a very good sign overall. That means we've got a collective immunity from all the people who've had COVID, all the people who had COVID and the vaccines, and the people who've just had the vaccine. So that's what's driving the whole thing lower and lower and lower. Now we'll see how low it goes. Nobody thinks it's really going to go away, but we don't know where that kind of bottom is, where it will bottom out in terms of the morbidity and mortality.
Mm-hmm. And on the same theme, but with the seasonal flu, it seems that respiratory illness and trend is also going down. Can you break it down for us?
Yeah, no, same thing with the flu. So flu, COVID, respiratory syncytial virus, we focus on those because those are the ones that can put people in the hospital, including children, and can kill people. So those all are life-threatening infections. The flu cases are also declining at this point, as expected. However, in the last few weeks, there have been 17 additional pediatric flu deaths. So the total number of childhood deaths is 151. And I mean, this is obviously a big tragedy. And the number of adult deaths also, they're coming down, but there's still too many of them. And what we've seen is that the people going in to get tested at the peak, in January and early February, was as high as 31.6% of people going in with a flu-like symptom actually had influenza. And that has now fallen to just 13.3%. Same thing with outpatient visits. That number has come down significantly. So that's all going in the right direction. But it's not over yet. So if you've got flu-like symptoms, get tested, find out if you have the flu, because there is treatment if you're eligible to take the treatment.
Mm-hmm. And in terms of flu prevention, there was a real world data study published recently about the effectiveness of not this season, but last season's flu vaccine. Can you break that down for us?
Yeah, you can't judge the effectiveness of these vaccines until basically after the season is over. So that's why we're looking at last year's results. And this year's will be very similar. I mean, this is done every year like this, but that's why we're looking at last year. So this study was of over 6,000 patients. In the journal was Clinical Infectious Disease, a very respectable journal published by Oxford University Press. And they looked at these people and Of them, 38% reported getting the flu vaccine. So that's it. It's recommended for almost everybody 6 months and older. So that's kind of the typical uptake response that we see in the United States. This is low but predictable. Okay. So the virologic efficacy, which is keeping people out of the hospital, keeping people alive, keeping people healthier. They showed that the overall vaccination effect reduced outpatient medically attended influenza by 44%. So it's almost half of the people. Yeah, half the people. You're getting a much better response than at least 44% of the people that had the vaccine. So that's good. And these are typical medical studies with all sorts of other statistics in it. And they showed that the highest benefit actually occurred in the youngest people. So children and adolescents, um, kids from 8 months to 8 years of age, that efficacy rate was almost 60%. And so why is it that the kids do better with the vaccine? Well, because they don't have any, or fewer of them have immunity from prior infections or prior vaccines. So the older you get, the more vaccines you've had, and the more times you've had the flu. And so you get this kind of protective effect. The same thing happened in the 1918 pandemic, which was, of course, very devastating. The younger people took the big hit in that one. And that's what everybody's, afraid of, that kind of severe flu coming back. But so anyway, this is, I mean, that just shows that these vaccines are very effective, and it's recommended for everybody 6 months and
Mhm.
older.
And for those young people, the adolescents, is that lack of, history with the flu the reason why they're more susceptible to severe disease as well?
Oh, right. Yeah, because it's the first time they're seeing, if they get influenza, if they get flu, it's the first time their body is seeing flu. So it has to make all the antibodies and everything, and they can get very, very sick. The first time you get it, you get very, very sick.
Mhm. And speaking of people getting very, very sick, unfortunately, we are still experiencing a large measles outbreak here in the United States. Can you please break down the latest case numbers for us and what we're doing to try to quell this outbreak?
Yeah, the cases are probably well over 400 at this particular point in multiple states, but it's mostly in Texas. Texas was reporting Friday, March 21st, 309 cases. And there's still just the two deaths. There's one in the child and one in an adult. Neither one of them had been vaccinated. But New Mexico and Oklahoma are also reporting these cases. And most of those cases are people who are not vaccinated. So what's happening is that the vaccination rate for measles, which is the most infectious disease known to man, actually, is as soon as that number goes below 94% or so, you start seeing cases pop up. And this place in Texas has one of the lowest rates in the country. And that's why they're having it. And it's embedded in the community so much now that the epidemiologists and flu experts really think that um, they're not going to be able to get control of this thing for at least a year. So this is going to smolder over there in West Texas and surrounding counties in New Mexico and Oklahoma for another year. So remember in 2000, there were no cases of measles in the United States when the vaccination rate was high. None. And now, as those rates go down, we're going to see stuff like this. And this is going to continue if the vaccination rate continues to decrease, which unfortunately is predicted to happen.
Mhm. Very unfortunate. We will keep our eyes on this as long as we need to, but
Yeah, I mean,
not what
and
we want to hear.
measles vaccine is an old vaccine. It's, some 60 years old or so. And I mean, it's been around for a long time. It's very effective. And it's just so unfortunate. All preventable. All this is preventable. The deaths, the hospitalizations, including even two pregnant women who got measles while they were pregnant. This is very dangerous for a pregnant woman. These people get very sick, and we don't know the outcomes in those pregnancies yet, but this is very unfortunate.
Yeah, very scary news. We will keep up to date on those specific stories if more is published. But moving on to our other big story is the H5N1 avian flu. We're finally starting to get some solid data regarding milk production changes and how the disease is really affecting the animals themselves. Can you tell us about some of those results?
Yeah, we're we I've been mentioning and other people talking about what we know and don't know about avian flu. We don't know about avian flu in the animal populations. Well, we know in birds, like when a flock of birds gets infected, like up to 90% of them get it and they die. That's why they call it bird flu or avian flu. So in cows, we know they get it. They don't die off like birds do, but they still have their own set of problems. So this was a nice study um, from researchers at Cornell University, and they looked at an Ohio dairy herd with 3,900 cows, and they found that 20% of them got affected. So in the setting of a dairy farm, during an outbreak, it was 20%. So it's certainly not like bird flu among flocks of birds, which is more like 90%. But anyhow, they noticed in these cows that as soon as they got infected, even before they got infected, they had a dramatic drop in the amount of milk production by actually 73%. And if you do the math on how long those cows are out of production and how much milk is not going to be available, it ends up costing in a herd like that $737,000. So it's a huge hit to these dairy farms. I mean, this is a lot of money for a farm like that. Most farms in the United States are large. The bulk of them are over 1,000 cows. And you can see what the economic impact is on this. During the outbreak, when they were testing the cows that were sick, they had seroprevalence rates up to 90%. So that means 90% in the subset that were actually getting infected had evidence of exposure to the avian flu virus. So we're learning more what happens, at least in the cow population. We know what happens in the birds, and I think as time goes on now that everybody's more tuned into this disease, that we'll find out, more about different animals, cats, seals at Lincoln Park Zoo, and so forth. We'll learn more about it because that's very important information that we need to know.
Mhm. And as we will get into later, there are a lot of different subjects and illnesses that are not getting the funding right now, but the avian flu epidemic right now is getting significant federal funding to look into that. So that is
That
a
that
positive
is
there.
that is going. There were some people that were let go originally. They were called back. I mean, this is really a crisis because we still don't have evidence that it's being transmitted person to person. So everybody's kind of waiting for that day because a big switch is going to go off, and we'll start vaccinating people against avian flu.
Mhm.
They're getting it all from
Very
the
serious.
up
Yeah.
to. Mhm.
Hopefully that day does not come, but I mean,
Right.
we will see. But something last year that had record numbers was dengue fever, and we got a warning from the CDC that we could see another record high year this year. Could you tell us about the current cases?
Well, we talked a lot last year. Last year was a huge dengue year. I remember it starts in the southern hemisphere and then flips up here, just like the flu. And last year was a very bad dengue year. Those big years typically come for some reason every 4 years. So now, we had a bad year last year, but the cases are up compared to last year in the United States. So what's happening is the whole dengue environment is expanding. So we're having cases up this year 113% compared to the same time a year ago. There's a lot of cases in Puerto Rico, in the Virgin Islands, And then last year, most of the cases of dengue in the United States in people come from people who travel to those high risk areas. But three states, Florida, California, and Texas, reported local dengue cases. So that's really, it very rarely happened before. But now we have three states reporting basically local dengue. It's really amazing that that's happening. So we'll probably see even more of that. And so the CDC has recommended that, if there is a suspected case, you have to test it. So of course, you have to go through the process of doing the test. So, these numbers are probably very much underreported. But they're recommending that the CDC's dengue PCR test be used to confirm a case.
Mhm. Another disease we will keep our eyes on, and like you said, likely underreported. And on top of that, most people do not get sick when they are infected with dengue. There's a lot of asymptomatic infection. But for those who get sick, I understand they get very sick.
They get very sick and they can die. So the mortality rate is not high, but if you have a whole lot, a low mortality rate, like with measles, is significant.
Absolutely. Now, our final story for today comes as the Director General of the WHO has last week come out and given some specifics about the United States funding changes and what those consequences may be or already are. Can you tell us about what he said?
Well, this is really the story of the week or the month or whatever. This is the story of today, that the US pulling out of USAID, now possibly even PEPFAR, that's the HIV treatment program. On the whole, there's a big international fund for AIDS, TB, and malaria. And all that was either financed in the United States by PEPFAR or USAID. And all that appears to be just falling apart at this particular point, as USAID has basically been dissolved in those three diseases. So let's start with malaria. Over the last couple decades, over 2.2 billion cases and 12.7 million deaths have been avoided because of all the efforts to control that disease. So, you have mosquito control, you have treated bed nets, there's vaccines now that are available that reduce the rate. They're not anything like the measles vaccine. I mean, which is like 97% effective. But they're good enough to drop the whole rate because so many people can die from this thing. So already, because of the USAID dismantling, there are countries that are reporting major diagnostic medicine and insecticide treated bed net stockouts right now, and that they're predicting that countries could see 15 million malaria cases and over 100,000 deaths worldwide this year alone, which reverses 15 years of progress. We're making progress every year for 15 years. So that's the story with malaria. PEPFAR is the one that's falling apart as we talk. This is George W. Bush's original plan from 2004, bipartisan agreement mandated by Congress, approved by Congress, President's emergency plan for AIDS relief. It helped give HIV treatment in 50 countries around the world. And what's happening now is 8 of those countries, the poorest ones of those, have reported substantial disruptions in the administration of drugs. They're running out of drugs. So HIV is unique and unfortunate in that you have to have treatment daily for life. It's been beautifully documented that these people take their medicines and that they do quite well. Their response rate to the medicines is actually better than ours. So they want to take it, they want to live. And if the more people that take it, the fewer people get infected. And as soon as you stop that treatment, the virus comes back. So what happens when it comes back? They get sick, they die, you have orphans out there. You have more children getting infected. I mean, it just cascades down in the wrong direction. Now, okay, if the United States government wants to get out of PEPFAR, there's a way to do it safely. You could taper it down over a 3-year period. I'm just kind of estimating that would be a typical time to be able to fill in the gaps. But if you just stop it like what we're doing now, this is going to result in a huge number of people going off their medicine, getting sick, getting the kids sick. More, it's affecting actually in Africa in particular, it affects women twice as much as men. It's a disease of women predominantly and children. Um, so this is a disaster that's happening right in front of our face right now. And to do it the way we're doing it, the United States government is doing it, is nothing short of being absolutely cruel. This is just cruelty, unnecessary cruelty. It could be wound down. Let's wind it down. If we want to wind it down, you know, other people, other countries, they can come pick up some of the slack, but you can't do that overnight. And that's what's happening right now. So that's the PEPFAR thing. TB in the same kind of thing. TB is now the leading cause of infectious caused death in the world. It now beating out COVID and HIV and all the same. So there's similar programs for TB diagnostics. We have a program ourselves, which has not been impacted yet, except in South Africa, where of course we have the most HIV patients in the world, and their number one infection they get is tuberculosis. So it's all kind of intertwined there. But what they're starting to see is stock out in the drugs and the tests that are available to diagnose these people correctly and to see and to monitor them, see if their treatment was successful. So the same thing is happening with TB. 9 countries are reporting failing supply chains for the drugs, and this is putting people at risk. And this is a totally treatable and curable disease. HIV is not curable. It has to be treated for life. TB, you can cure TB. You can cure TB just by giving them the medication. And we were making actually really good progress. There's some vaccines on the horizon. Haven't worked yet, but nobody's giving up on that. But it is a tragedy in the making.
Absolutely. This is a story we will continue to follow for a long time, I suspect for several years, to see the fallout of these impacts and the consequences that are occurring.
There is no agency big enough or government big enough to come in and fill this gap that the United States is creating. It doesn't exist. Bill Gates was interviewed recently. Maybe the Gates Foundation. I mean, it's so big, has so many billions of dollars and stuff. Well, they're already working in the field. They're already part of the solution. They they don't have the money. They can't fill a gap that big. It's impossible.
Mhm.
Especially overnight. You know, you could have the countries kick in more money, and a lot of them will, but they don't have, many of these countries just absolutely do not have the resources.
Absolutely. It is very, very tragic. And on that note, I'd like to thank you, Dr. Murphy, for breaking it all down for us, keeping us in the loop and in the know so we know what's going on. It's much appreciated.
Well, thank you, Katie. And we'll see you
And
hopefully at the end of the week. I'll be traveling again. I'll be in Nigeria. I'll see what's happening there. And hopefully we can broadcast from there. Otherwise, it'll be next week again.
absolutely. We hope to see you later this week. If not, we'll see you early next week. And thank you so much for joining us. If you have any questions, comments, or concerns, please comment them down below or leave them at any of our social media linked in the description. Have an excellent week.